Hey everyone, it's Dr. Ramani. Okay, this is actually probably the most difficult video that I have tried to put together to date. This particular video has actually required lots of research. I'm spending a few months on this one, lots of reading, pondering, review of case notes, review of clinical and theoretical writings. But it also is probably, this video answers, or takes on at least, the question we have received most from viewers and from people emailing and requesting content. But this topic is also really personal for me because someone very, very dear to me, probably one of the most important people in my life, lives with autism. So for me, getting this right is incredibly important to me, and it's why I've put in the work, but I really, really want to clear up the questions a lot of people have been struggling with. The question that has come up over and over and from so many people is, can you please explain the differences between autism spectrum disorder and narcissistic personality styles? So a lot of people are seeing overlaps. They want to understand the differences. Now, let me open up by saying there's so little research on this particular question. You'd think there'd be more, but there's actually really not. So it was interesting for me cobbling together reading and theoretical research on narcissism, research on autism spectrum, and there were a couple of research studies, a few bits of research out there that connected the two. The most useful study on this I came across came from Strunz et al., and the lead investigator in that particular paper is based in Berlin. The paper's from 2015, so it's pretty recent. Other papers looking at this question look at much finer grained kind of points. So I'm going to try to integrate all of this in the most understandable way, not be too professory and too teachy, but try to make this point as clearly as possible. Now, I'm also aware that this is a video on YouTube and it's not a scientific lecture or a university course. So I'm trying to find a balance between clarity and accuracy here. So bear with me. So let's start with clarity, okay? Just for clarity's sake, narcissism. Anyone watching this channel, you know what this is. It's lack of empathy, entitlement, grandiosity, envy, validation seeking, superficiality, egocentricity, shame, feelings of inadequacy, an inaccurate sense of sort of an overblown self-esteem or an inaccurate self-esteem, impulsivity, manipulation, arrogance, sensitivity to rejection, sensitivity to feedback, dysregulated rage, a sense of victimhood. You know this, right? The empathy deficits in narcissism are quite variable, okay? So at times, a narcissistic person may actually be excessively attuned to other people, usually in what we call an instrumental way. So basically, a narcissistic person, if they want something from you, they can turn on the empathy long enough to get what they need from you. So empathy then becomes something they can use to get supply. Relationships for narcissistic people are largely viewed transactionally. I'm going to give you something so I can get something. Intimacy is very shallow. Relationships help narcissistic people regulate themselves because relationships are a source of supply. And the relationships really exist only to serve the narcissist's needs with very little interest in the other person. Narcissistic relationships are characterized by arrogance, deceitfulness, callousness. However, a narcissistic person is able to be, and many of you know this quite well, to be quite charming, confident, and charismatic, especially at times when there is a need for personal gain. Narcissistic folks tend to be quite extroverted, and that extroversion helps them quite a bit because they need to draw and attract other people for narcissistic supply. This is all the stuff you know. Vulnerable narcissism can actually muddy the waters of understanding narcissism a little bit. Vulnerable narcissism is all the stuff of narcissism, but with a more socially anxious, introverted presentation. Vulnerable narcissism tends not to be pretentious and charismatic, doesn't tend to be as superficially showy, but it's an interesting kind of a game there because people who are vulnerable narcissists will often have a really grudging contempt for those who have all that superficial showy stuff. In a strange way, the vulnerable narcissistic people may want it. They often don't have it. They have contempt for people who do, or even for people who value it, even though they do, right? Vulnerable narcissists tend to be sullen, quite victimized. There's lots of deflection of blame, little ability to take responsibility, lots of tendency to blame the world for their misfortunes, and the rage we see in vulnerable narcissism tends to be very ruminating and passive-aggressive. So now let's talk about what autism is, or autism spectrum disorders are. Autism is a neurodevelopmental disorder which impacts social and verbal communication and interpersonal and social interactions. The DSM defines it according to deficits in social communication and interaction. And this can be things like having difficulty maintaining conversations, not sharing emotions, difficulty with social behaviors such as eye contact, difficulty understanding the emotional worlds of other people, or a lack of interest in relationships. Second is that in autism we may see patterns of behavior that may be restricted or repetitive, like repetitive behaviors or repetitive vocalizations, inflexible routines, really fixated interests, reactivity to certain sensory inputs like noises in the environment, or a fixation on something like a sensitivity, maybe even being fascinated by something like a light. These patterns are present from an early age, typically under age 3, and in most cases can cause significant impairments in functioning. Now, in some individuals with autism spectrum disorders, there can be significant intellectual impairments, while in others, no such impairments are manifested or are present. The origins of autism are being explored widely by researchers, with research suggesting a genetic or a heritable component, dysfunction in the mirror neuron system in the brain, and issues related to theory of mind, which have all been suggested. Also research looking at differences in brain waves, and these all connect to the theories around mirror neurons and issues with specific brain structures. That is a brief definition. Again, there's much more out there on autism you could read to get a deeper dive into that. But the real question of this video is trying to take on is, why do people think there is an overlap between narcissism and autism? The question keeps coming up. Now, for the purposes of the narcissism versus autism distinction, I'm going to be making a presumption in this video, okay? We're going to need to start from the presumption that people who have, we're talking about people who have autism, who have normal or high levels of intellectual function, which is something that's often called high-functioning autism spectrum disorders in the literature, okay? So we're not talking about people with significant intellectual impairment. Now, a big part of why people inquire about the overlap between autism spectrum disorders and narcissism clearly relates to the empathy deficits that are observed in both autism and in narcissism. The social processing issues that characterize autism can result in interactions with individuals who are living with autism that may be experienced as though that the person with autism is lacking empathy or any kind of regard for the other person in the interaction. And we'll talk more about that. Now, in addition, other qualities of individuals with autism include things like straightforwardness. And straightforwardness is this concept of simply saying what they think or believe or observe. That kind of straightforward communication can feel unfiltered or even hurtful. In general terms, people often judge people with autism and narcissism. In both cases, they're often viewed as being self-focused, again, lacking that empathy. Now, some of the best work I have read or seen differentiating narcissism and autism comes from this research study by Strunz, who's in Berlin, and her colleagues. So let's start with the empathy issue, because again, that tends to be sort of the pivot around which all of this spins. There is a suggestion that people with autism spectrum disorders are not able to easily recognize or identify emotion in either themselves or in others. This inability is in line with something that's called problems with cognitive empathy. Cognitive empathy is the ability to understand and label a feeling. People who are narcissistic tend to have fully intact, their cognitive empathy works. They understand feelings, but they don't value or care about the feelings of other people, and they have little interest in them. In that way, it appears that the empathy issues for individuals with autism spectrum may actually be sort of earlier in the pipeline. For a person living with autism, there is actually an inability to identify feelings or emotions in themselves or others. That's that cognitive empathy piece. The narcissism issue is much farther up the pipeline. Narcissistic people know emotions, they understand emotions and feelings, they can identify them. They can identify them in other people, but they just aren't always interested in them. There's a difference, okay? And I hope that that difference makes sense. Another difference that has been suggested by the research also relates to the introversion-extroversion dimension. In the research, consistently what has been suggested, not surprisingly, individuals with autism spectrum disorder always had lower extroversion scores than narcissistic individuals. So there's a very introverted element to autism spectrum. People with autism spectrum disorder also tend to be less novelty seeking. They're not as interested in new things or new experiences or new feelings. While that kind of openness to novelty, the next new thing, is something we definitely observe in narcissism. Novelty seeking is very much a part of the narcissistic picture, as is reward seeking, doing things that feel good, right? Though people who are living with autism spectrum disorder are open to new intellectual experiences, but not so much to open to new feelings or inner feelings. This also relates to something that's called alexithymia, a fancy word that really gets at the inability to name emotions. That alexithymia is observed in autism spectrum. It's sometimes observed in narcissism, but in narcissism, when we see that incapacity to name emotion, it seems to be more of a psychological defense than a real deficit in social processing, like we see in autism. So when there are overlapping dynamics between autism and narcissism, the thing that drives those dynamics tends to be very different in a person who is narcissistic and a person who has autism spectrum disorder. So things may sometimes look similar, but the thing that drives them is quite different. Now, interestingly, if we're looking at other personality dimensions and issues, people with autism spectrum disorder tend to have higher levels of conscientiousness than narcissistic individuals. And we see the biggest differences relating to things around order, things being in a certain order, and discipline and dutifulness, like following rules and doing the things that are required of them. People with autism spectrum are very, very sort of focused on doing those things right and in order. That's quite different in narcissism. Now, in some narcissistic individuals, we may see this need and lots of control around this concept of order, but it's in this way that there's a demand that other people or the world around them is as organized and things are done exactly and precisely the way the narcissist wants. These demands are often antagonistic and demanding, and that precise need for order from a narcissistic person typically reflects a way of maintaining dominance and control, a different function than we see in autism spectrum. And for autism spectrum folks, they tend to be much more willing to do things in a dutiful, follow the rules, right? The straightforwardness we see in autism spectrum, that's another big issue because it can be experienced as hurtful by other people. A person just coming out and saying the thing that they observed or witnessed. Now, the challenge there comes to those down to those deficits in emotional processing we see in autism spectrum. When someone with autism spectrum disorder just comes out and says something that literally reflects the experience that they were having, they also have an inability or an impaired ability, again, due to those social processing deficits, to consider the impact of those words. They just say it. Now, in narcissism, when hurtful words come out, there's often an impulsivity, a knowledge They know that the words could hurt, but there's a relative indifference to that impact for the they don't care. Like, I said it, all right, fine. It hurt you, okay, oh well, whatever. Narcissistic people, we know that they're sometimes able to contain themselves when it's strategic, right? So the narcissistic person won't blurt out something and just say anything, even if it's just straightforward at a boss. Why? Because they want to stay in good regard with the boss or someone else they're trying to impress. But they'll be very sort of straightforward and say that, whatever, even difficult toxic words, to someone they may deem as less important, like a partner or a family member. Now, impulsivity is another place where narcissism and autism spectrum diverge. Impulsivity is very much a part of the picture of narcissism and all antagonistic personality styles, but it is not something we would observe in autism spectrum disorder. In fact, individuals living with autism may be very, very deliberate in what they say and in what they do, and often in a very well-ordered kind of, patterned way. This is quite different than narcissism, where things are said and done impulsively with little regard for consequence. And then, if the thing is something that hurts other people, the narcissistic person will get angry that other people are upset with them because of the impulsive thing they said that they said or did, and they're upset that people want to hold them accountable. So, in autism spectrum, those empathy deficits, as it were, those abrupt words, those straightforward words that can feel so direct as to be hurtful. Again, I'm going to repeat this. They reflect the social processing deficits in autism, something occurring at the level of the central nervous system. And it's here we see this really complex interweaving, like I said, of mirror neurons, limbic system activation, autonomic nervous system, and a lacking of this sort of idea of the theory of mind. Now, people who are hearing this straightforward stuff can experience this as selfish. However, the research also suggests that individuals with autism spectrum disorder are actually quite modest. They are not at all grandiose. They don't have the processing, the social skills to be manipulative. They're not callous, and they're not invalidating. The empathy deficits in narcissism appear to be more defensive and self-protective. They often reflect a combination of disregard for the feelings and experiences of other people, despite the fact that the narcissistic person has intact cognitive empathy. They do understand the experiences of other people. So that part for them works. The inadequacy and insecurity at the core of narcissism means that many defenses are employed to protect their egos, right? These defenses are things like grandiosity, projection, entitlement, arrogance, distorted self-esteem. Motivationally, the narcissistic individual wants to maintain power and control. Again, the hedge against that fragile ego. Themes such as entitlement, grandiosity, arrogance, validation seeking, envy, self-victimization, these are not part of the autism spectrum picture in any way. To be able to manipulate, to gaslight, to be charismatic and charming in public, and then be able to rage at someone in private, even in the car on the way home or behind closed doors when nobody is watching, requires significant interpersonal and strategic awareness. That kind of social processing is not something we would see in somebody living with autism spectrum disorders. The stress of these impairments in interpersonal and social functioning and the subsequent challenges can often be manifested as social anxiety and even negative mood states such as depression in people living with autism spectrum disorders. In contrast, the extroversion that we observe in most people with narcissism means that by and large, social interactions are not stressful for them. In fact, they want them. If the social interactions evoke shame, then the fallout would be rage, not necessarily anxiety. Shame is not likely to be a primary state in autism spectrum disorder, largely because shame is driven by an assessment of what other people think about a person. And since the theory of mind is limited in people with autism spectrum disorder, that sense that other people are judging them badly is not that likely to be pronounced. If the only deficit you are experiencing with a person is an empathy deficit, and there is no evidence of entitlement or manipulation or charm and charisma or grandiosity or validation seeking or arrogance, there is a possibility that you may be more likely to be in the presence of someone who has patterns consistent with autism spectrum disorder. Ultimately, this isn't your call to make, okay? This is now we're talking about something diagnostic. Now, perhaps the person you think has this pattern knows this about themselves. Perhaps they may need to get assessed. But going back again to this lack of empathy, the lack of empathy in the absence of all the other bells and whistles of narcissism speaks more to a social processing deficit rather than the ego-protective and antagonistic defensive structure that is narcissism. People with autism spectrum disorder have enough cognitive empathy, okay? It's not completely non-existent. They have enough of it to be aware that to say or to do a hurtful thing is not okay. They're not driven by that. And they're not indifferent to knowing that they harmed someone when they're told about it. In fact, individuals with autism spectrum disorder may often be quite genuinely remorseful and sad at learning that they may have caused harm to another person through their words or through their straightforwardness. And given such feedback, will check in and apologize and try to learn to do better. A person with narcissism, on the other hand, will either be dismissive or minimizing or contemptuous. If a person said, hey, the thing you just told me hurt me, they're not going to care. Big difference between the two. There are other issues I know and other questions people may have, such as whether autism spectrum and narcissism can co-occur. Yes, they can. It's a very complex issue. I will try at some point in the future to cover that in another video because that gets complicated. It can happen. It's pretty rare, but it definitely can happen. I do know that many people out there will often attempt to subsume narcissistic patterns in someone they know under the potential banner of autism spectrum. Just be careful about doing that. These again, it's very nuanced. To just make it about lack of empathy really misses the massive differences between these patterns, again, over-focusing on just those empathy deficits, and also misses that many, if not most people, with higher functioning autism spectrum disorders, despite the social processing issues, are open and willing to receive feedback and not react with rage when feedback is given. Cognitive dissonance for people who are experiencing any kind of unempathic relationship can mean that if the lack of empathy could be understood through more of a central nervous system issue or a neurodevelopmental disorder such as autism, then maybe there is sort of a different kind of hope and justification. But to do so is actually to do a disservice to those living with autism spectrum disorders. And to do so can mean actually that people aren't getting the right help and might even keep people stuck in antagonistic relationships that they're mislabeling incorrectly. I do hope that this video gives a tentative glimpse into a very complex question that many people have had. I've attempted to bring in what we know about origins, the phenomena, the similarities, the differences, and the confusion. And another thing to also keep in mind, developmentally, autism spectrum patterns are manifested at a very, very young age, again, under 3. We would not see that in an individual with narcissism. I mean, all little kids are selfish, right? That's the nature of the child is separating and individuating. That's the hard work of childhood. They have to be focused on themselves. The child is trying to develop. So it's a whole different game because those autism spectrum patterns would have manifested earlier. Our ability to be able to identify and diagnose autism spectrum has obviously jumped in quantum leaps in the last 10 to 20 years, which is why people who are older, over 40 or 50, maybe even over 30, may have been missed in early developmental assessment. So, but it is not beyond the pale, and I've worked with some people in the field who really do work on the diagnosis of autism spectrum in adulthood. But I hope this, again, keeping that in mind, the developmental pictures are different, everything's quite different. We can't get lost in just that one overlap of lack of empathy. Lack of empathy by itself does not a narcissist make. It goes a lot deeper than that. I'm sure some of you will have comments. I do hope I've answered this as respectfully and holistically and completely as possible. And I do hope this answers this question for many of you who've asked it. Thank you again. Thank you again. Thank you again.